Hi, my name's Erin Aafedt. I'm a speech-language pathologist and I work at Mountain Valley Regional Rehabilitation Hospital over in Prescott Valley. I'm here today to talk about what we are calling cancer prehabilitation and rehabilitation. And in a nutshell, I'll explain this more later in the talk, but we want people who are diagnosed with cancer to be more prepared physically and mentally before they start their cancer treatments and then during their cancer treatments so that they come out stronger throughout the whole process. So just some facts and figures right now. In 2019, there was over 1.7 million cases of new cancer diagnosis in our country. Cancer is mainly a disease of the aging, affecting over 80% of people, let me back up, 80% of all cancers diagnosed are in people over 55 years of age. And in 2019, there was over 600,000 deaths related to cancer. The good news is that the cancer death rate has actually dropped 27% since 1991. Due to the treatments that are being so successful. So that is good news. Also, what is good news is that chemotherapy is shifting from IV infusions, where you're stuck in a building for several hours getting things dripped into your arm, to oral medication that you can do at home. So that is a lot easier for patients to manage. I'm going to talk about a couple of research studies related to what is called health-related quality of life. There was a study in 2012 comparing health-related quality of life in cancer survivors with other people. And all the cancer survivors reported a much lower quality of life, both physically and emotionally, compared to normative populations. The leading cause of emotional distress with cancer survivors is actually the physical disability that they experience. Another study evaluated about 1,300 survivors of cancer with, I think there was 10 different types of cancers in that population. And 40% of those patients felt like they had unmet physical rehabilitation needs that were not picked up by physicians and then not worked on. So the underdiagnosis of physical impairments is very common with cancer patients, and cancer survivors are left to their own to accept a new normal or accept a new self-identity. And I will say that that actually happened to me. So shortly, I will say that I had to have, I think, 6 things of chemotherapy, a cancer that was caught really early, but I did experience some physical disability just from those 6 treatments. And I lost my grip strength, and I was foggy in the head, and I think back now, I'm like, man, if I had known about this before, I might have done something early on. And so that's what we're trying to come out with this videotape here. So we're talking about impairment-driven rehabilitation for cancer. So you can have impairments and you can have disabilities, but they're not exactly the same. The impairments can cause the disability. So it's important that cancer survivors are screened for some impairments so they don't experience those disabilities later on. It's not only the physical disabilities of fatigue or numbness, but also some cognitive impairments that are happening. In my handout that you can access on this website, there's a little graph showing kind of a trajectory of if cancer patients have no screening for physical or emotional disabilities or impairments, if only one of those things is screened, or if both of them are screened. And then when both physical and mental or psychological things are screened and addressed, then their quality of life and quality of healthcare related things is much better for them. There's lower healthcare cost, and there's a significant improvement in function overall. So let's talk about some common physical impairments that can lead to functional limitations with people who have cancer and who are going through cancer treatment. So lots of people know that there's what they call cancer-related fatigue, or CRF, and 75% of patients will have this cancer-related fatigue beyond their treatment period. So it may last for 6 months or 12 more months after you've done your chemo. So that's one thing. A second physical impairment is pain. Up to 50% of patients undergoing acute cancer treatment will experience pain, and about 70% of people will have chronic pain when they have metastatic disease, which means the cancer is in multiple places at that point. Also, there's something called chemotherapy, this is a long name, chemotherapy-induced peripheral neuropathy. And neuropathy just means that the peripheral nerves, not right in your brain or in your spinal cord, but the ones that are going out to your body and your toes and your feet, those get affected, and they cause pain, numbness, burning sensation, tingling sensations, and it's very painful. And it often causes balance problems in those patients as well. So imagine you're walking and your feet feel like they're stepping on tacks all the time, or your hands and fingertips feel like they're burning. It's very common with chemotherapy. Lymphedema is another problem that usually happens more often with breast cancer patients. So when they remove the lymph nodes under your arms, sometimes lymphedema happens, and that means that your body isn't getting rid of the fluid in the lymph system. And one leg or one arm may be much bigger than the other one, and there's therapy and tools to make that less. Also, what can happen is what's called cancer-related cognitive impairment. People better know that as chemo brain. The chemo drugs cause neurotoxicity, and that might lead to mild cognitive impairment. So what that means for people is that they're foggy mentally, they're forgetting things, they can't find their words, their attention span gets lost, and they just feel scattered. Like you can have this type A person that's, on the go, 24 hours a day, high pressure job, they start chemo, and they can't multitask. They can't remember their appointments without constantly looking at a calendar. And they're having trouble talking with people because they get stuck on their words. All right, so the good news is, so those are all like physical symptoms. What I really want to talk about now is how research is showing that prehab can be very beneficial for people who are about to undergo chemotherapy or radiation therapy. So some of the research showed, for example, that lung cancer patients, when they went through a prehab program, they improved their breathing, their overall strength. The surgery was easier for them, and they had fewer post-operative complications. There was another article that said rehabilitation efforts should begin at the time of cancer diagnosis and continue throughout treatment and after treatment ends. And they talked about getting baseline measures. And then there's another article in 2012 that talks about nutrition and physical activity. And that came to the conclusion that physical activity is safe and feasible during cancer treatment. It can improve your physical functioning, your fatigue level, and a whole bunch of other quality of life issues. Also, there's no evidence saying that exercise has any negative effects on chemotherapy or with chemotherapy and the patient's outlook. You want to keep in mind that you might have to exercise at a lower intensity level or maybe not as long, but we are still going to encourage you to maintain your activity as much as possible. In the specifics of people with head or neck cancer, when they went through a prehab program that taught them to do exercises that related to keeping their swallowing function better, they had less problems eating and drinking after their treatment. Sort of the same thing with men with prostate cancer. If they were given exercises that are called pelvic floor exercises, then they were less incontinent issues after their treatment. And people with breast cancer, when they were shown exercises to do before and during treatment about range of motion, then their arms didn't get so frozen and lack mobility later. So, prehab, that's what we call, should use like a multimodal approach that not only looking at exercise, but looking at nutrition and stress and a whole bunch of other factors to look at the patient as a whole. So we want to get across to people that are cancer survivors that you don't have to accept a new norm, that you can improve your overall function in life and your quality of life when you're provided some guidance of what to do before and during your treatment. So exactly what is a prehab program? It is a coordinated program to assess and recommend interventions and strategies that are developed to assist the cancer survivor to prepare both physically and emotionally and mentally for their cancer treatment. It utilizes outpatient services to complete baseline assessments prior to the start of your cancer treatment. If you're already in cancer treatment, though, come on in too. So we're going to look at providing a person home exercise programs, give them an understanding of what to look for, monitor you throughout the months, give you follow-up phone calls, maybe have you come back in. It might be a class that you go to in your community that is a pre-treatment chemo class, kind of like they do for if you're getting a new hip or a new knee. So with a prehab program, you would have a physical therapy evaluation. And they would have recommendations for home exercises and give you education. Same with occupational therapy and speech therapy. Also, a prehab program should have a nutritional screening by a dietitian who could also provide recommendations and suggestions for your intake. Psychosocial well-being screening should be conducted to assess the need for counseling or follow-up interventions with a psychologist or a counselor. The program should have available a social worker or a psychologist and a physician who has knowledge about the rehabilitation process overall. And there should be some follow-up for you after a month to check in. How are you doing now that you started your cancer treatment? Do you have any questions? Do we need to bring you back in? So, most importantly, a prehab program should have a good relationship with your oncologist or radiation oncologist so that they can share information back and forth of things that each other is seeing and keep in touch that way. So more specifically, physical therapy would address not only your strength and your range of motion, but also your endurance and your stamina and balance issues. Endurance, stamina, and balance are common problems with people going through cancer treatment. Physical therapy is mostly working on your core, which is this part, your abs that no one likes to do sit-ups for, and your leg strength. Occupational therapy is also going to address strength and range of motion, endurance, and stamina, but as it more relates to you being able to complete your daily activities like getting dressed, taking a shower, emptying the dishwasher, doing laundry, carrying the laundry, folding the laundry, making meals, that kind of thing. So they want to keep you to be able to do those daily activities that you need to do. Speech therapy would address any concerns related to swallowing, how your speech sounds, your thinking skills, which, like I said before, that chemo brain takes effect and you start not thinking very well, as well as your ability to retrieve those words that you get stuck on while you're having a conversation. The dietitian will determine how many calories you should be eating each day, talk to you about appropriate food choices and strategies to maintain your caloric needs. All the staff is going to provide the survivor with educational handouts ranging from, what is chemo brain, what is endurance, how to deal with diarrhea or constipation, which are common things with chemo. Maybe transportation services if you live alone and you got to get to your appointments. How do you do that? So individually, as you need, we can provide you with some educational information. So, the need for physical and mental exercise. The main point is start early. Before you start chemo or radiation, try to find a prehabilitation program if you can. If you're already undergoing cancer treatment, you're already in chemo or radiation therapy, or both, still try to get into a comprehensive therapy program that has physical therapy, occupational therapy, and speech therapy, so all your areas could be addressed. So a last thought. So there's this book, and it's by a doctor named Julie Silver. She had cancer herself, and she wrote this book before and after cancer treatment. One of her quotes in the book is, "It can help," meaning prehabilitation, "can help you get as strong as possible physically and emotionally before you begin treatment." And you want that because you want to stay strong during your treatment. So if during your treatment you're getting weaker and weaker, and maybe you're having a hard time managing at home, having more balance issues, if you're having a significant decline, you could get admitted to an acute rehabilitation facility. Inpatient rehab will work daily with you and slowly improve your strength and endurance in order to return you home so you can complete your tasks more independently. An inpatient rehab will have a physician, they'll have nursing staff, they have PT, OT, speech therapy, a dietitian, a pharmacist, a case manager, a psychologist is on staff as well. And all those are there, so you would get 3 hours of therapy a day, and that can be spread out from 6:30 in the morning till 4 o'clock in the afternoon. So 3 hours sounds like a lot, but if you spread it out, it's really not that bad. The nursing and the dietitian staff is going to monitor your nutritional status and your hydration constantly, and everything's coordinated very well in an inpatient rehab facility. Alternatively, if you didn't want to leave your home, you could get home health services come to your own home, and they would help you with those exercises, working on your endurance in your own home. Alternatively, again, if you've been to prehab, still declining, you're not getting all your exercises done independently at home, you don't want to go into a facility and stay as an inpatient, you can go to outpatient therapy 2 or 3 times a week, and all those therapists could work with you at that point. So, from my standpoint, like I said earlier, I had a stage 1 cancer diagnosis in 2018 at the very end, and in 2019 I had 6 one-month doses, 1 day, 1 time a month for 6 months of some chemotherapy. Like I said, I got my hand strength got a little weak, couldn't open my bottles anymore. I got really tired all the time. And my mental, it wasn't too bad, but I could tell I was a little bit off it sometimes. So, of course, I'm a speech language pathologist working in a rehab hospital, and I thought, gosh, I wish I had known all this. I would have probably asked my coworkers what I should be doing. But because of the incidence of cancer, our hospital, Mountain Valley Rehab Hospital, has developed this prehabilitation program. So we do have all the things in place right now that I've just talked about. And if you are interested, you can call my therapy director, whose name is Brian Shaw. His number is 928-775-7895. You could call me directly, Erin Aafedt. My work number is 928-775-7877. One of us should be able to help direct and get you into a program if you desire. Again, it's all about getting stronger before you start any of your therapies so that you can tolerate your therapies much better overall. And I hope that was informational to you. All the information I just talked about is in that handout that is attached to this presentation. So thank you very much.